Just hours ago, Sacramento County declared a state of emergency. ABC 10's Roxanne Elias is live in the studio tonight. And Roxanne, you've been hearing from health officials and people impacted by this.
I have today, Chris. Now, there are several reasons why a county may declare a state of emergency, but Dr. Olivia Kasiri says panic is not one of them. They're just trying to stop the spread of monkeypox before it hits harder. There is no discrimination against who or where monkeypox is attacking.
I was exposed to monkeypox through casual contact. I ran into a friend on the street. We proceeded to hug and kiss on the cheek. My friend had a single lesion on his cheek, which he had mistaken for an ingrown hair, resembling a reddish pimple.
David Watson, a resident of San Francisco, ended up with monkeypox just days after fighting COVID.
I ended up in the ER 3 times over the course of 4.5 days with excruciating pain that opioids could barely touch.
This is what Sacramento County is working to prevent. At 73 cases, on Tuesday, it declared a state of emergency.
The reason for that is so that we are able to get access to additional resources such as mutual aid. We know that there are challenges with people, for example, being able to get tested and also being able to access the treatment and the vaccination, and also, again, resources for those that are on isolation.
Dr. Olivia Kasiri says the proclamation doesn't indicate an increase in the risk to the general population. Instead, it marks the virus as an urgent issue for local health systems to work together.
One thing we would like to do is be able to open up more slots at our public health clinics so that people have more access to testing. And then with the treatment, because of the approval process right now in place with the Centers for Disease Control, there are only a few providers that are able to complete all the paperwork.
They're working closely with UC Davis Health and Kaiser Permanente with an effort to prevent monkeypox from infecting someone like David Watson.
We need better access to all forms of treatment, and we need equal access for all. We need to stop the suffering now.
Right now, UC Davis Health is recommending patients who are concerned about a possible monkeypox infection to contact their primary care physician's office and ask to speak to an advice nurse. The advice nurse can then provide guidance on how to obtain further evaluation and assist with scheduling a test if needed, Chris.
That is good information, especially it's kind of shocking to hear him say he was able to contract the virus by just kissing someone on the cheek, okay? So one thing we want you to do is, if you want more information, we have that on our website, abc10.com/links. Roxanne, thank you.